We will start with elbow joint examination. First, inspection. We will note the carrying angle. From front, for scars, deformity, any swelling, erythema. From side, for fixed flexion deformity, scar, swelling, erythema. From behind, for rheumatic nodules, psoriatic plaques, any swelling, any erythema. Palpation. Assess and compare the joint temperature. Palpate lateral and medial epicondyle and olecranon process. Palpate for any swelling. Palpate the tendon of bicep with elbow flexion to 90 degree. Now we will begin with the movements. Supination, pronation, elbow flexion, elbow extension, passive elbow flexion, Now we will begin with the special test. First, valgus stress test with elbow flexed, used to assess the integrity of the medial collateral ligament. VARUS stress test with elbow flexed for the lateral collateral ligament. Passive extension of elbow. Valgus and VARUS test with elbow extended. Medial epicondylitis test or the golfer's elbow to screen the patient for medial epicondylalgia or the golfer's elbow. Mills test or the lateral epicondylitis or the tennis elbow to determine the presence of lateral epicondylalgia. Cousins test or the lateral epicondylitis to evaluate for the lateral epicondylitis. Lateral pivot shift test or the posterolateral rotatory apprehension test to assess the posterolateral instability of the elbow. Now we will see joint play elbow. These are the small movements that are independent of voluntary muscle contraction, measuring less than 1/8 of inch in any plane. These movements provide roll, glide, spin, and distraction combination to aid in smooth joint motion. Capsular laxity allows for this joint gliding motion and is essential for producing optimal active and passive ranges of motion. Distraction, OLECRANON on humerus. Distraction, radius on humerus. PA glide, radius on humerus. AP glide, radius on humerus. Tinel sign used to detect the ulnar nerve entrapment at the elbow.